Hello, are you considering rhinoplasty or nose job surgery? Are you someone who is not happy with your shape of nose, the size of nose, or do you have a nasal deformity? Do you think you have breathing difficulties because of deviated nasal septum? If the answer to above questions is yes, then this video is for you because we'll be talking in depth about rhinoplasty, what is rhinoplasty and what is septoplasty. Hi, I am Dr. Rajat Gupta, board certified plastic surgeon working in New Delhi, India. So let's talk about what is rhinoplasty and what is septoplasty. Now, our nose is made of bones and cartilages. There are lateral bones on the sides of the nose in the above portion, and the below portion has cartilages. There are different cartilages. The central cartilage is called as septal cartilage, and then there are upper lateral cartilages and the lower lateral cartilages in the nose. These all structures form the structural support of the nose. And over these structures, the nose is covered with skin and underlying mucosa. Now, septal cartilage actually divides our nose into two nostrils. So, if someone has a septum can be deformed into different shapes, like a C shape or an S shape, or a different shapes in which it becomes deviated. What this actually reflects on skin is a deviated nose or something which is not straight. So what you need in such scenarios is septoplasty. Now what is septoplasty? In septoplasty, we remove a bit of a portion of septal cartilage from the center, making septum absolutely straight. This procedure is called as septoplasty. Now, along with this procedure, if someone wants to improve the shape of nose, the width and the aesthetics of nose, or their tip, or their base of alar cartilages, or the width of the nose, or they have a hump, then all these things can be corrected by a procedure called as rhinoplasty. So many times we actually combine these two procedures called as rhino-septoplasty. So let's talk about what is rhinoplasty and how it is done. Now in rhinoplasty, what we do is we make small incision inside the nostrils and one small incision at the base of the nose. And we open the skin cover of the nose like a cover of a book. And then we do all the modification or the structures which I talked about. If suppose a person has a wide nose, we do osteotomies, that is breaking of bones and bringing them close together. If someone has a hump over the nose, we see whether the hump is basically of the bone or whether it is a cartilage. If it's a bony hump, we rasp it. Now I use an ultrasound assisted device called a pizzotome to rasp the bony hump of the nose. That instrument actually makes the procedure very, very precise and neat and absolutely bone specific. So we do not injure any other tissue. If this hump has a cartilaginous component, so we resect the cartilage. If someone has a depressed nose or a saddle nose, we put something on a dorsum called as dorsal graft. This graft can be taken out from the septal cartilage or a rib cartilage, or we can use an implant. If someone has a wide nose on the below, we resect the alar cartilages and bring them closer. If someone wants a tip to be sharpened, we sharpen the lower lateral cartilages to give them a much more defined tip. If someone wants a tip to be rotated up, we use something called a cephalic dissection of the lower lateral cartilages to rotate the tip up because nobody likes a drooping tip. So these are the changes which can be done during your rhinoplasty. Now after the surgery, we close the skin cover which we had raised and the sutures which are used inside the nostrils are all absorbable sutures. You will have a splint on the nose which is like a plaster on the nose. So understand that we have modified the structure like you would have any fractures on your limbs and the doctor will apply a plaster or a splint. Very similarly, a splint is applied on the nose. This splint is kept for 1 week. Now, the way I do my surgeries, the patient actually go back home the same day. We do rhinoplasty most of the time as a daycare surgery. They go back home the same day and are physically fine from next day to do all their daily activities. They do not require any kind of bed rest. And the way we do our surgeries, patients do not counter any pain whatsoever. From next day, they are physically fine to do all their daily activities. Only thing is that they are socially restricted because of the splint which is on top of the nose. Now, this splint is removed after 1 week, and then you are able to see all the changes which we have done for your nose. Once we remove the splint, patients' reactions are very nice to see. They can see all the changes, the hump gone, the width reduction, the tip being more defined. And at that time, there is some swelling on the nose, which persists for a few weeks and months for certain cases. And as the swelling goes down, the patients can appreciate the result much more. Their nose gets much more defined and sharper. A lot of people ask me, Doctor, is rhinoplasty safe? So my answer to them is, it's absolutely safe procedure if done by a good surgeon at a good center. You need a good surgeon and a good center with good infrastructure facilities and tools like piezotome, which I told you. So if you have a good surgeon at a good center, it is a safe procedure. At the same time, a lot of people ask me, Doctor, what to expect? Will I be able to breathe through nose? Will I have some swelling around the cheeks or not? So you will be able to breathe through nose, but you will have some nasal congestion kind of feeling for first 1 to 2 days in certain cases when we use nasal packs. Many times we avoid using nasal packs because we use like a tube so that the patients are much more comfortable and they breathe the same day. But certain cases we use packs and you feel like nasal congestion, like you feel when you have a common cold kind of thing during winters. Now, these packs are removed after 1 day and then you are able to breathe very easily. As far as the swelling is concerned, usually you have swelling on the nose which is not substantial and not noticeable by anyone else other than you and me, which goes down in a few weeks to months as I discussed. In certain cases, patients may have swelling on their under eye area, which usually subside by 7 to 10 days. Other than that, it's a very, very comfortable surgery and one of the most gratifying surgery in our practice because you see the change of your nose shape immediately, and nose being a centerpiece of your face, it makes a great impact on your overall face and personality. I've tried to answer most of the commonly asked questions regarding rhinoplasty. If you have any more questions, keep writing into us and I'll be there to help you. Thank you.